Hello, everyone, and thank you all for joining us during the Lytham Partners Spring 2024 Investor Conference. My name is Adam Lowensteiner, Vice President of Lytham Partners. Before we begin, for those not familiar, Lytham Partners is one of the country's leading investor relations firms. With more than 2 decades of corporate access experience, we have built one of the industry's most diverse and effective platforms for connecting small-cap companies with high-quality and focused institutional investors while creating a framework of best practices in all aspects of investor relations. Today's discussion is hopefully yet another example where we can bring value to multiple constituents. Our next fireside chat is with Reliq Health Technologies, ticker symbol of RHT, that is Robert Harry Thomas on the Toronto Venture Exchange, and RQHTF, that is Robert Kubek Harry Thomas Frank in the United States. Joining me from the company today is its Chief Executive Officer, Chris Shields. Today, Chris and I will engage in a fireside chat-like Q&A session. We will dive into the discussion in a moment, but one final item, I want to remind everyone that Reliq is available for one-on-one meetings. If you've not already signed up, please send me an email at lowensteiner@lythampartners.com or visit lythampartners.com/spring2024. From there, you can click on the investor registration button and make your one-on-one selections. With that said, let me now turn today's discussion over with Chris Shields, CEO of Reliq Health Technologies. Hi, Chris, and welcome.
How are you, Adam?
I'm good. Thanks for doing this. Appreciate it.
Yep, glad to do it.
So let's expand a bit on a few topics. Maybe to kick things off, Chris, you were recently appointed CEO. Can you tell us a little bit about yourself, your background, how you got involved in Reliq?
Yeah, I have over 30 years of healthcare technology experience. And I've worked at a range of different companies of all different sizes, from large Fortune 500 global companies to several small startups over the last 30 years. I've worked everything from research and development to manufacturing, marketing and sales to general management. I previously worked with Dr. Lisa Crossley at another startup that she had called Matrix Separations, which was then acquired by Merck. So she had called me back in late 2018 asking if I'd join the company and head up the US operations. So for the last 5 years, I've been working with the US team, building the US team, mostly business development, sales, and operations.
Great. For some of the newcomers to the Reliq story, what does Reliq do and what markets do you serve?
Yeah, so Reliq develops and provides innovative virtual care solutions for the healthcare market, primarily in the US for Medicare and Medicaid patients who are chronically ill. Our technology, though, can be used anywhere. We've had deployments in Australia, Canada, Mexico, Nigeria. We do a lot of work in the Caribbean and Puerto Rico and the US Virgin Islands. But we support about 20 different billing codes and 8 to 10 different Medicare and Medicaid programs that really are providing services to patients who have the least access to care, but really need constant monitoring and someone to really help them manage their chronic illnesses. The goal here, both at the U.S. government and CMS level, as well as Reliq's goal and most primary care doctors' goal, is to keep these patients out of the hospital first, but really to improve their quality of life and really, at a minimum, keep their current chronic illnesses at a stable and consistent basis, and have them not have ups and downs in their lifestyle and their health due to maybe changes needed to their drugs that they're taking, or small changes to their lifestyle choices, or just periodic updates with their doctor to make sure that they're on track with their goals. So what Reliq does is we provide that care to these patients. We help to connect their primary care doctor with their specialists, with if they have to go into the hospital, with the hospital, and then re-entrance back into their home. So the goal, again, for Reliq is to provide continuum of care for these chronically ill patients who really need, monthly, if not weekly monitoring and updates, both from a care manager as well as from, their doctor. So Reliq provides a whole range of services in our virtual care model. We provide, the software to track the patients that can be used both by the clinical providers, the doctors, their nurses, their nurse practitioners, but can also be used by the patient themselves as well as their family members. We also can provide a full turnkey service to any of our clients, where we would provide implementation services, pre-authorizations, care management staff that would, really be an extension of the doctor's offices. And so our goal here is to make this as easy for our clients to implement and to manage, but to really make sure we maximize the potential of these programs to really improve patients' health outcomes.
So next question is, I have to get this out of the way, but can you get us updated with regards to the company's audit and timeline for filings of filing all the financial filings that are in arrears? Maybe walk us through the process or sequence of events.
I can't provide a lot of details until after we do the filings. We're making a lot of progress, and I know it's taking a lot longer than anyone thought. Again, we expected this to be done, earlier than it has been done, but we are making progress, and we're very close to completing the filings and issuing, the financials for the year end, and that'll be followed quickly by the quarterlies that we're behind in. I can't give a date, but I can say that we're very close, and there should be some positive announcements coming out soon.
Great. Can you update investors where we are with regards to patients in the pipeline and expectations for onboarding those patients onto the iUGO platform?
So what Reliq has is we've over the last few years signed up clients, and our goal for the last several years has been to get as much market share in this virtual care market as we can. And so we've signed up a lot of clients. Our clients, both everything from home health agencies to individual doctor practices to large U.S. healthcare providers. We have well over 1 million patients that are eligible for these programs within our pipeline. Our focus for the last several years has been trying to convert that pipeline into detailed implementation plans by our clients. And so we have about 200,000 patients that we're focused on getting onto the iUGO platform. We talked about a year ago the issue we had with lining up our onboarded patients with our patients that are billable. And so we've really been focused on the billable patients. We started out at relatively low adherence levels, and we've been slowly improving those through a number of programs that we've discussed in the past, mostly where we work either with our clients or we manage the patient's adherence almost totally with our own internal teams. And so our goal is to get that adherence from 20%, where it was a year ago, to over 70%. And we've shown with clients that we have managed long-term that we can get that adherence over 70%. Once we can get that higher level of adherence, our onboarded numbers and our billable patients will be something that can be more predictable for investors. But again, our goal for onboarded patients, we're working towards getting that first 200,000 that we have detailed implementation plans for onto the Reliq platform.
So how is the business doing? I mean, it sounds like things are percolating nicely. Can you provide a brief summary of how business is performing? What are you seeing in the marketplace?
Yeah, so the business, as we've announced, previously, we're adding about a doctor practice a week, and that will add, 25,000 or more patients a year to our platform. We signed up last year 4 large health providers, one in South Texas, that's a subsidiary of one of the largest U.S. health plans. The second one was we actually signed up 2 groups that were working in South Florida doing skilled nursing facilities. And so we have about access to about 200 of those skilled nursing facilities in Florida. And then the fourth one was a large healthcare provider out of Kentucky that has 80 skilled nursing facilities over several states. And so for the last year, 18 months, we've really been working with those 4 large health plan providers to get them up and running. Collectively, they have well over 1 million, eligible patients. In South Texas, we started off with about access to about 10,000 patients. And we recently announced that that has been expanded to from South Texas to Laredo, and then by the end of this year into San Antonio, which that'll give us access to over 50,000 patients. But this client has over 200,000 just in Texas. And by themselves, they have over 1 million throughout the US. We recently announced another expansion from one of our clients in Florida, but it is doing skilled nursing discharges and managing patients within skilled nursing facilities. And we've recently expanded that contract into Pennsylvania.
So the company has been announcing some new wins and in new geographies, as you mentioned. How is that coming about? Can we see more states to be added in the near future?
Yeah, we've been focused on California through to Florida, really the southern U.S. For the last several years. That's where the rates of hypertension and diabetes tend to be the highest in the U.S. But we also have those. A lot of those geographies have a lot of very rural areas, and their patients have a lot of barriers to getting adequate health care. So they have the least access to care, but in many cases have the highest need for it. So that's really been our focus. And, between California, Texas, and Florida, those are the 3 largest states by population. And then adding Pennsylvania, and we just recently added a sales team in New York. So we'll have 5 of the top, population states that we'll be operating in. But we are making more progress with our sales teams in California, up into Oregon and Washington State. Our teams in Florida and in the Caribbean are making, additional inroads into other states that are nearby. And so each of our sales teams is really focused on their own geography, but just by word of mouth, we tend to expand the business geographically.
So a little bit more on patient adherence. You mentioned before, and you mentioned the progress Reliq has made in this area. Also, there are discussions that Medicare is looking into redefining protocols and making adherence issues easier. Is that the case? Can you elaborate a little bit on that?
Yeah, to me, that's one of the more exciting developments that has come, across for changes to the system. We have seen Medicare add a lot of new programs over the last 5 years, add a lot of new billing codes. Mental health has been a big one they've expanded on. They've added chronic care management for pain. They've added remote therapeutic monitoring for musculoskeletal and breathing issues. And so there's been a lot of expansion, but remote patient monitoring was one of the early programs that they implemented, and they have adherence at 16 days of readings per month, which doesn't seem like a lot every other day, but there are a lot of chronically ill patients that really struggle with meeting those 16 days of readings a month. And even a patient with 5 or 10 readings can really see an improvement in their health outcomes, yet the doctor won't get reimbursed for those patients. You can have a patient, and we see this all the time, that a patient will not be feeling well. They'll take their blood pressure, and they'll find that it's really elevated. And so we'll give the doctor a call. They'll go into the office, and the doctor will change their medication or provide some other intervention for them, and really keep them out of the hospital. So even a patient who's only taken 5 or 10 readings can really improve their health outcomes, get monitored care, throughout the month, and make changes to, any part of their health plan that will keep them out of the hospital. So, there's a whole range of patients that will be provided additional care even with less readings. But there's also a whole group of patients that don't need to take readings every day. If you're someone on a weight management program, your weight generally doesn't fluctuate on a daily basis that much. And so they're really on a weekly program to monitor and manage their weight. Patients on sleep apnea or patients whose condition has stabilized still need to be monitored to make sure it doesn't change, but they don't need to be monitored every day. And so there's a whole range of patients that benefit from remote patient monitoring, but don't need to be on a program where they need readings 16 times a month. So this will be a huge improvement. Not only will the readings, the proposal is for readings from 2 to 15 as a new code, as well as right now the care manager has to spend 20 minutes of time with the patient. And that will be, there'll be additional codes for 10 minutes. So there'll be patients that can do readings anywhere from 2 to 15, and then there'll be a code for 16 to 30 readings, and time from 10 minutes to 20 minutes, and then 20 minutes to 40 minutes, 40 to 60, 60 and above. So they're really expanding the ability for doctors to monitor patients under a whole set of new unique conditions, and not just the patients who have chronic illnesses that are out of control and need to be monitored daily, but patients who only need monitoring, weekly or twice a week.
Mm-hmm. Got it. Thank you. Can you please spend a few moments, Chris, on some of the new initiatives, especially, the opportunity of providing services for patients suffering from mental health issues? What's the landscape like? How does it differ from the traditional patients Reliq has been onboarding?
Yeah, so it doesn't differ a lot, although it opens up a lot of new patient potential for us. So CMS says that approximately 50% of all chronically ill patients have some mental health challenges. That may be depression, maybe Alzheimer's, maybe dementia, may even be substance abuse. For those patients, we find that it's significantly underdiagnosed by the primary care. And so we only have about 10% of our patients that are diagnosed by their primary care as needing mental health services. But one of the codes that CMS has is to do twice a year assessments, cognitive assessments on the patients. And so that's something we've recently added, which will help us to bring those patients that have been underdiagnosed, bring their full diagnosis and add them to mental health programs. The reason CMS has really added a lot of mental health programs over the last few years, they've added additional codes, but they've also allowed not only doctors to bill for these, but also therapists. Because one of the big issues that CMS has identified is there are a lack of in-office resources for mental health. It's very difficult to get appointments and to, especially if you need more frequent FaceTime with a practitioner, it can be very difficult to get the needed services. So by providing some of these services remote, at least you can take the patients that have the first stage or lowest levels of behavioral health issues and get them some services. We expect that we'll have about 30 to 50% of our existing patient population on some sort of mental health program by the end of 2024. That should add over 10,000 new patient programs to what we currently do. And between the cognitive assessments and the monthly billing for behavioral health, we'll probably be able to bill an additional $30 to $40 per patient just for mental health programs.
A couple more questions here. What's the selling cycle been like in recent quarters for Reliq? What's the sales team look like? How do you find your customers, or do they find you?
Yeah, it's a combination of our team going out and finding new customers, but most of our business over the last few years has been by word of mouth. We started out 5 years ago going to trade shows and doing a lot more advertising, a lot more push marketing. But we found that, for every doctor that we do sign up, he has 10 friends who are interested in the program. And of those, maybe we only sign 3 or 4, but those 3 or 4 have an additional 5 or 6 friends who are interested. And so we really get this cascade effect of, leads that come into the sales team. But we have dedicated both internal sales team and external sales consultants. Our internal sales team is following up on, leads that come in from, they may come in from our website. They may be, a referral from another client. And then we have sales teams in California, Texas, Kentucky, Tennessee area, Florida, Puerto Rico, the U.S. Virgin Islands, and now we have a new one in New York. And those sales teams tend to have people in them that have 20 to 30 years of healthcare experience, have sold widely in the market a whole range of different products. And so they have a contact list of many large clients. Some of them could be large physician practices, or even they were previously executive management within a health plan. And so those are the ones that we're relying on to get these larger contracts. So we have kind of a 2-tier approach, one where we have our really experienced sales consultants that are going after the larger accounts. And then we have our internal sales team that is, going after the individual doctor practices or large doctor groups that we get, referrals from.
So that here's our time for this fireside chat. But before we conclude, anything else you want to add to the discussion before we conclude?
Yeah, all I would say is I know it's been challenging for a lot of our investors, from October to now. We're really looking forward to getting the financials filed and behind us, getting back to trading, and then getting back to what we would say is business as usual. This market still has, a huge amount of potential. They keep adding programs and services, and we're really positioned well to take advantage of that in the future.
Great. Thank you very much, Chris, for your time today. We greatly appreciate you and doing this for us. To anyone out there who's not already signed up for a one-on-one, again, please send me an email at lowensteiner@lythampartners.com or visit lythampartners.com/spring2024 and click on the investor registration button. We hope you all enjoy the rest of the conference and have a great day. Thank you.
Thanks, Adam.